let's look at that because it's in of itself is its own problem. Remember, for these patients, they have fluid volume deficit. So because they're putting out so much either through vomitus or through diarrhea that they don't have enough circulating volume. So we need to look at replacing that. Nausea and vomiting and diarrhea can also cause problems with skin integrity. Remember, if we're not keeping those little cells fully hydrated, they lose their little fluffy parts, and they're not as effective at protecting the patient. And we get skin tears, skin breakdown, and that kind of stuff. And with those skin breakdowns, we have an increased risk for infection. So that's not a good thing either. So we really need to work on doing what we can to control a patient's nausea, and we'll look at some medications for that, so that we can encourage these patients to intake fluid and proteins and the like. Another cancer treatment, as you're writing these out, radiation. Some of the common problems with radiation that we talked about are impaired skin integrity. It can also impair the skin integrity in the oral mucous membranes, so they can have stomatitis. So we need to look at providing these patients a soft bristled toothbrush. You need to really watch the males that you take care of. They're really bad about going and buying that firm bristle or hard bristle brush, because if soft is good, hard is better, because I can brush my teeth less time with this toilet bowl brush, basically getting in there and removing plaque and what have you. So you need to encourage these patients to switch over to a soft bristle toothbrush. Maybe you need to move over to the little swabbies that you see for oral care, because they're soft as well. These hard bristle brushes and stuff can actually damage the skin in there, especially if it's swollen. We then have an increased problem with bleeding. We have an increased problem with risk for infection because we've opened that pathway. Radiation, we have to look at pain. And so you can go back to your previous concept map and look at some things you can do for pain. Altered nutritional status, what are we going to do about correcting that? You'll notice on your concept map that you put off before you started this activity that debulking has got a couple of different lines leaving it. Remember, if we debulk a tumor before we do chemotherapy, there's less material there to have to kill with the drug. Likewise, with radiation, if we've removed part of the tumor, then there's less there to have to irradiate and remove that way. This covers the content that was covered on Friday. I'm going to post some other PowerPoint presentations in order for you to look at some oncology emergencies. One of the questions you may be asking yourself is, can I find the PowerPoint online? And the answer is no. They did not serve you guys well on the last test at all. There were several questions that came directly from those PowerPoints that were missed, almost wholesale. So at this point, we're wanting you to use these concept maps to kind of take notes. If you need to listen through this presentation again, please feel free to. If you have any questions, also feel free to use the discussion board. Classmates have posted a lot of material out there, and I encourage you to look at that.